what I want you to do is hold that form in really nice and tight, okay?
Families are working, there's nobody home, they need people to take care of them. And so we have to be able to provide that in a knowledgeable, caring manner.
Did you hurt anything else?
And do it as professionally as possible. That's what HPAE is to me.
The health professionals and allied employees are setting the standard for quality patient care and quality working conditions for all healthcare professionals. HPAE has been growing steadily since it was founded by registered nurses at Englewood Hospital over 30 years ago. Today, we're the largest and strongest healthcare union in New Jersey, representing more than 11,000 professionals. We all face plenty of challenges. Hospitals would rather install a fancy fountain in the lobby than hire the right number of healthcare professionals for safe patient care.
Healthcare has become more like a corporate machine. The first cuts were really at the bedside.
Sorry to say, but I think that hospitals have become a business, just like Macy's.
Hospitals would rather give executives fat bonuses than give healthcare professionals decent pensions. But HPAE and our members stand up and say that's just not right.
I'm going to watch you, and HPA is going to watch you, and we're going to ensure that you're going to fight for the patients that we take care of.
We know what the needs are. The union protects us and gives us the right to be very strong patient advocates. We have a voice.
Nurses and healthcare professionals join HPAE because they are able to speak with one voice on decisions affecting their patients and their professions. Diminishing numbers of staff are working exhausting hours trying to keep up with sicker patients who are in for shorter and shorter stays. Worsening conditions have caused an exodus of nurses, pharmacists, technicians, and social workers.
I was considering leaving nursing because of some of the very unfavorable changes in healthcare. Nurses got out of the profession and found it much easier and less stressful to take a job as a rep for a drug company or in a doctor's office or something of that nature. So we've lost a lot of good nurses over the years.
But instead of leaving their professions, HPAE members are fighting back to help their patients and save their profession, organizing and winning standard-setting contracts, advancing our professions,
Staffing levels.
and advocating for quality health care.
HPAE has made a big difference at Bayonne Hospital. We had short staffing. One of the reasons was that we had a lot of our vacation time taken away from us, sick time. These benefits are very important for people that are working. The girls were doing a lot of overtime. They couldn't get home to pick up their children. They were getting sick, and we were just exhausted. So we decided that we needed a union. And since the union came, we have regulations in our contract for safe staffing, no mandatory overtime. The wage scales have much improved, and our benefits that were taken away, we are now getting our benefits back.
And that's what I tell many, many members. You have to be active. You have to be part of the solution.
Being unionized builds a profession. If you're not unionized, you can't grow as well because you can't get the things you need.
Being unionized gives you job security, makes it fair. There's rules to follow on your own behalf and on your management's behalf, and you have a contract. You have a legally binding document that is extremely important.
HPAE contracts protect working conditions and our patients. They include safe staffing guarantees, job security, enforceable limits on unsafe practices like floating, wages that attract the best and reward experience, retirement security, and safe workplaces.
We feel that we need the union because right now we have no voice at all.